Hello and welcome to Hudson Health. My name is Dr. E.J. Akunyele. I am Chief Medical Officer at Jersey City Medical Center, a facility of RWJ Barnabas Health. Today, I cannot be more excited to talk about something very close to my heart, women's heart health, no pun intended. For many women, they do not see, it takes everything for them to get to see a doctor, and many of them may never have seen a cardiologist or thought they had any risk factors. Yet, heart disease remains one of the killers of women in our society and only gets worse. So today we want to explore all things women's heart health with Dr. Alexandra Ward, who is the director of our Women's Heart Health. Not only is she an exceptional doctor, but has specific training in heart disease in women. We're going to talk about detection, the differences in men and women, the role of hormones and even stress and depression and heart disease in women, and how we go forward from screening and detection to treatment. Something that I talk about on the show all the time is lifestyle modification. We understand it's not very easy for a lot of us, but really how do we modify our lifestyle to prevent heart disease? As always, Jersey City Medical Center and RWJ Barnabas Health has an entire suite of experts, physicians, cardiologists, social workers, everybody needed for your health at every age. We'll be right back with Dr. Ward.
Jersey City Medical Center is healing, enhancing, and investing in Hudson County because your heart doesn't beat just for you, so get it checked. When your bones are healthy, it lifts us all. We're delivering joy daily in our Lord Abbott Maternity Wing and providing New Jersey's only NCI-designated comprehensive cancer center. We'll continue building our medical network and taking every precaution for your safety so that we can all be healthy together.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Hello, welcome back to Hudson Health. My name is Dr. E.J. Akunyele. I am Chief Medical Officer at Jersey City Medical Center, a facility of RWJ Barnabas Health. Today, I have the unique privilege of welcoming Dr. Alexandra Ward, the Director of the Women's Heart Center, Jersey City Medical Center. Welcome, Dr. Ward.
Thank you.
You recently joined us. I'm so excited to talk to you today because this is a topic that many women have questions about. But before we start, tell us a little bit about yourself and your medical journey.
Absolutely. So I actually started my medical journey here in New Jersey. I went to New Jersey Medical School.
I did not know that.
Yeah, so very excited to be back in the Garden State.
Well, welcome.
Thank you. I then did my residency at the University of Maryland Medical Center.
That's where I trained.
You did?
Yes. See, okay.
We know. I was chief resident there. And then I did my fellowship, my cardiology fellowship training at Thomas Jefferson University Hospital in Philadelphia. I've been in practice now about 6 years after fellowship. And I was in Virginia. And again, very happy to be back here in the Garden State.
Well, welcome back.
You.
And you have a particular interest in women's heart health. We don't hear that all the time. So just in general terms, how is that different from men's heart health or anybody's heart health?
So excellent question. I think very important for women to know this, that heart health and heart disease particularly is the number one cause of death in women. 1 in 3 women will have heart disease, and then 1 in 3 women will die from heart disease. So it's very important that we talk about this. So thank you for the opportunity to discuss it. And the reason that heart health is different in women is that basically what causes heart disease, that pathophysiology, we call it, the things happening in the body, is just different than men. And because of that, women are more predisposed to certain types of heart disease that men are maybe not. And so their symptoms will be different. And because of that whole constellation, it can be confusing when women have heard heart disease presents like this for so many years, but those weren't the symptoms that I was having.
So the tight chest pain and doubled over. So women don't present like that. How do women present, and what should they be looking out for?
And so when we think of chest pain, we're thinking about something going on in the coronary arteries. So those are the arteries that are bringing blood to the heart, keeping the heart healthy and strong. And so traditionally, when we think about heart disease, we're thinking about big blockages or plaque rupture causing those big blockages. And those are the classic symptoms that we've heard about in the past, that elephant sitting on the chest, radiating to the jaw or down the arm. While women can have that type of disease, they also tend to have different coronary issues or different issues in those blood vessels. The little blood vessels can cause problems. And so because of that, women tend to have a chest symptom, but it tends not to be that crushing elephant sitting on my chest. It tends to be a burning sensation, maybe a different type of pain. And that's the kind of pain that women will tend to have. Additionally, they will have other symptoms such as extreme fatigue, feeling very short of breath, nauseated, hot and sweaty, and back pain. And they tend to have multiple of those symptoms, which of course can be confusing if they're not aware of what those symptoms are reflecting.
Not only are they confusing, they could be non-specific, especially in women who are used to doing so much, and they might just think, I'm just getting tired from all the work I have to do, and not that I could have heart disease. So it's really interesting you said this. So since women present so differently, what could we be doing? This is an emergency really in our society, and what would we be doing more to tell women to what to look out for? Should they be seeing their PCP? Should they be seeing a cardiologist? What do you advise?
So number one is knowing your risks. So that's very important because I think a lot of times women will also say, oh, women don't get heart disease. That's a disease of men. And we know that's not true. And so it's very important to know what the risk factors for heart disease are so that women can say, okay, if I have these risk factors, I need to talk to my primary care and then maybe get a referral to a cardiologist. Now, if anyone is having any of the symptoms we just talked about, they definitely want to seek medical attention right away. And I always like to tell my patients, particularly, you know your body the best. So if you are feeling something out of the ordinary and you have that gut sensation that something's wrong, that's a reason to go to the emergency department because anything happening with the coronary arteries is a medical emergency. But we'd like to prevent that piece of it.
Absolutely. I would like us to have a whole segment on risk factors because that's so fascinating. But I do want to add to what you just said. Listen to your body. And it is so often that women are workers, caregivers, and they put that last, wouldn't you say?
Absolutely. Women definitely put that last. And I always like to say you cannot take care of anybody else unless you're taking care of yourself. So I think one of my best pieces of advice to patients is you need to prioritize your health, how you're feeling, so that you can then continue doing all those things you're doing.
Absolutely. And if something feels out of the ordinary, so you may, not be a marathon runner, but if you used to climb up the stairs in your house and you're now short of breath, climbing said stairs, it is not normal. And you should get medical attention. Just those little things that we could just brush off as part of everyday life, which it really shouldn't be. Awesome. We'll be right back.
Jersey City Medical Center has a passion for heart health. We're Hudson County's only full-service heart hospital with innovative technologies and premier cardiovascular physicians, a partnership with Rutgers Health, the latest technology and medical advancements, and nationally renowned care for every heart in every community. Whoever your heart beats for, our hearts beat for you. Jersey City Medical Center.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Welcome back to Hudson Health. I'm Dr. E.J. Akunyili. I'm Chief Medical Officer, Jersey City Medical Center, a facility of RWJ Barnabas Health. Excited to welcome back Dr. Alexandra Ward, Director of our Women's Heart. So we ended up last segment talking about risk factors. So for the layperson, what are risk factors for heart health, and what should somebody do if they have said risk factors?
Absolutely. So there's two things we think about with risk factors. I like to say the traditional risk factors. So what things everybody knows about. And so if you have these, it increases the risk or probability of you developing heart disease. And so the things we think about in that kind of traditional category that most people are probably aware of are high blood pressure, high cholesterol, being overweight, smoking, a very, very big one. And so those are things that people are definitely going to need to be aware of and to know their numbers. So know what your blood pressure is. Diabetes is also a risk. Know your A1C, and of course, know your cholesterol. For women, however, there's also kind of emerging, we say, non-traditional female-specific risk factors. There's a lot of risk related to pregnancy complications. So if a female has ever had gestational hypertension, gestational diabetes, preeclampsia, those are risk. Even if it happened when you were 22, that is a risk for them developing heart disease later in life. Additionally, autoimmune disease and stress and depression in women increase the risk of heart disease. So women actually have more risk factors than men do for developing heart disease.
So that is very interesting, Dr. Ward, because even when I train and I'm an emergency physician, you never heard of stress and depression being risk factors. We mostly thought the traditional risk factors. Is this emerging literature, or is it just more presentations? Can you tell us more? Because many women out there are going, well, I'm always stressed. So what does that mean for the average woman who feels like that's just a baseline state?
So it is emerging literature. We'll say basically, let's say in the past 5 to 10 years, this has been something that has really been looked at more. Again, because heart disease is the number one cause of death in women, and so many women develop heart disease. So it is important to know those. And for stress, we just know, don't have all the details behind why yet, but that stress and of course that anxiety, depression do increase that risk for heart disease. So that piece of it is so important because yes, we are all stressed, and especially women taking care of so many things at so many different times. It's very important to prioritize our mental health and to prioritize how we're feeling and to really check in to say, how are my stress levels and what can I do to mitigate that?
So we always talk about mental health, but you're really one of the few people I've seen tied in so closely. We've always intuitively known, and some of us have practiced in the field, intuitively knew there was a connection. But telling people that your mental health, your well-being mentally could affect your heart, I think that's just groundbreaking. For everybody at the back of the room, your mental health affects your physical health. So what kind of, so we've talked about stress, depression, risk factor. What are hormones? That's very, especially perimenopause and women in that season of their lives.
So hormones definitely play a role in the heart. There's actually estrogen receptors on the heart. There are certain conditions that are tied to hormones. So during pregnancy, again, some of those things that happen are really tied to the hormone and the hormonal changes. Some or abnormal heart rhythms can also be tied to those pregnancy changes. We see it a lot when women are menstruating. They'll have maybe those extra heartbeats or little runs of tachycardia. And around perimenopause and menopause specifically, we really see that heightened. And so there are actually cardiac manifestations of menopause. And so women feel these and sometimes dismiss the symptoms as just, I felt this. But it really is reflective of those hormonal changes for menopause. Once menopause is complete and women don't have that estrogen as circulating as it was before, then their risk of heart disease really does go up. It has to do with the metabolic changes that occur. As we all know, anyone who's been in perimenopause or approaching menopause, weight becomes a challenge. It really is very hard to lose that weight. And we know that's all related to the metabolic hormonal changes. And the same thing with cholesterol. So the bad cholesterol goes up, the good cholesterol goes down. So hormones play a huge role in cardiovascular health for women.
Great, that's good news. Anything else, Dr. Ward? But that's really good advice, because I think a lot of women, of all ages, but really around perimenopause, we've always, and I give a whole talk on this, always thought of menopause as hot flashes and GYN changes, but to actually think that there is a cardiac manifestation, as you said, and then understanding that your risk factors change afterwards. And that's all the more reason why women should see their doctors, take care of their health, and understand it's not in their heads. There's a real physiological changes going on.
It is, and I think that's such an important thing to highlight. It is not in your head.
Yeah. So we have so much to talk about. I have so many questions for you. We'll take a break. We'll be right back.
I've got cancer.
We've got the highest level of cancer care,
the latest clinical trials,
researchers working to find a cure,
and nurse navigators to guide you every step of the way.
At New Jersey's only NCI-designated Comprehensive Cancer Center, your safety has always been our top priority.
I've got cancer, but I also have peace of mind.
Jersey City Medical Center and Rutgers Cancer Institute of New Jersey. Let's beat cancer together.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or a quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Welcome back to Hudson Health. My name is Dr. E.J. Akunyili. I am Chief Medical Officer at Jersey City Medical Center, a facility of RWJ Barnabas Health. I have with me Dr. Alexandra Ward, Director of Women's Heart Health. Welcome. So we've had this really exciting conversation. I wanted to ask you about early screening, detection, interventions. Just take it away. Like, what do women do from 30 to 60? What phases of detection, and do you have any cases where early screening has saved a life?
Absolutely. I think that's so very important. I'm going to go even earlier, 1920. That's where we're going to start, because that really is the time that people can do a lot of great prevention. So it's really going to the doctor, which I know, especially when we're younger, we tend not to do because we're healthy, we don't need to go, but really going to the primary doctor every year, getting your blood pressure checked, getting that cholesterol checked, getting the A1C checked. Very important to do. In the 20s, do you have to do that every year? Not unless there's something going on, but definitely once we hit our 30s, particularly our 40s and 50s, that should be yearly to see your primary care and to get those labs checked and to get those numbers checked. And if there are any abnormalities in those numbers, to then be very aggressive with risk factor modifications, which can be lifestyle, but then also if medications are needed. And then additionally, any cardiac testing would be based on symptoms. So very important to have that conversation with your primary care about what symptoms you're having, if any.
That's perfect. Do you have any specific story of a patient who you've seen a positive impact by early screening?
Yes, absolutely. So had a younger patient, and I will say young in her 40s, whose only risk factor was actually having preeclampsia, who came in, was having chest pain, and the story was classic of those symptoms that we had talked about previously. Her first feeling of it. And so we took her and did catheterization, which is where we looked at those coronary arteries, and she had a 99% blockage in one of the arteries. So we put a stent in, and of course she felt much better. But that was a patient that otherwise, if we had not been thinking, yes, here she does have a risk factor with those classic symptoms, may not have been intervened on as quickly.
And I know you mentioned make sure you're going to your doctor, but part of your job and your responsibility at Jersey City, we're excited to have you in our system, is that we're making sure that all medical providers understand the differences in how women present. Because traditionally, many women have perhaps gone to the medical establishment and not getting these symptoms taken seriously.
Yes, and that happens, unfortunately, all too frequently, which is why having these conversations is so vitally important. So our patients know, again, what to be on the lookout for and to really be advocates for their health and to be advocates for when they feel like something is wrong. Again, talking about some of that testing, if, as you mentioned earlier, all of a sudden I can't climb a flight of stairs, I'm so short of breath, we would want to investigate that further. We would want to do ultrasound of the heart to see if there's anything going on with the pumping function or the valves, for instance. And so it's so important to really be an advocate for yourself and to speak up for when you're feeling something that is not your normal.
I really like that. But in terms of, so you've talked about early testing, you've talked about catheterization. Any other new technologies out there on the horizon?
Yes, absolutely. And we love them. So one is actually called a cardiac CT scan. It's a non-invasive way to look at the coronary artery. So it's a CAT scan. It does use contrast dye, and it shows us everything going on in the coronaries. I actually had a patient recently who did have a coronary event. She was a young woman, and when we did her catheterization, we couldn't see one of the vessels well. She got her cardiac CT scan, and we saw that there was an anomalous artery. So something she was born with, but just coming off not in the area we normally expect it to be. And so that CAT scan really helped us and will very much impact her care moving forward. We also have coronary calcium score, which is just a CAT scan, no contrast, that looks for calcium, which can be used as an addition to our risk modification and our risk score and our risk tools. And then cardiac MRI is a great other treatment, or not treatment, a great other imaging modality that we can utilize when necessary.
That's great. And patients can get all these testing at Jersey City Medical Center and RWJ Barnabas Health. But I guess the best message is that we're open, we're available to take care of you, for women and men of any age, but especially women who may not think they need to see a cardiologist. That's just not some. And then having women cardiologists, I think, makes access easier, because we always say medicine, when people have people who look like them and understand specifically their symptoms, they're more likely to go to a doctor. That's fantastic. So anything else you can tell us about screening? So we talked about starting blood tests. Is there an age where you should get a cardiac CT, or is that based on symptoms?
So those are based on symptoms. So the echocardiogram, the ultrasound, the cardiac CT, and cardiac MRI, all those imaging modalities we spoke about would be based on symptoms. There's also stress testing that we can do either on the treadmill or sometimes with medicines through the IV. Again, all of that is based on symptoms, so would not be just a general screening that anybody would get. In terms of the things, again, that are going to increase risk, your blood pressure, those labs we spoke about, and you could consider that coronary artery calcium scan to help determine treatments. For example, if there's someone who say, oh, your cholesterol is elevated, I'd like to start on medication, but they're a little hesitant, it's a great tool to say, okay, if it's positive, it actually does increase your risk, and then we're really going to want to help modify and mitigate that risk.
That's perfect. We'll be right back.
Jersey City Medical Center is healing, enhancing, and investing in Hudson County because your heart doesn't beat just for you. So get it checked. When your bones are healthy, it lifts us all. We're delivering joy daily in our Lord Abbott Maternity Wing and providing New Jersey's only NCI-designated comprehensive cancer center. We'll continue building our medical network and taking every precaution for your safety so that we can all be healthy together.
Welcome back to Hudson Health. I'm Dr. AJ Akunyili. I'm Chief Medical Officer at Jersey City Medical Center. With me is Dr. Alexandra Ward. Welcome back, Dr. Ward. So something very dear to my heart. I don't think we do enough of this in medicine, so I'm going to give you the floor. Lifestyle changes. What do women or anybody need to know about lifestyle changes to prevent cardiac disease? Right? There's some things like your genes which you can't control, but there's a lot that you can. What would you say to people?
Absolutely. I 100% agree. Lifestyle modifications, lifestyle changes are one of the best things that we can do to help prevent heart disease, and we can start them immediately. So the big things that I like to focus on are heart healthy diet and exercise. And then everyone always says, well, what does that mean? That's such a generic term. So heart healthy diet, really, we like the Mediterranean way of eating. I hate to use the word diet because it has such negative connotations with it, but really those lean proteins, fresh fruits and veggies as able, the whole grains and the good fats, staying away from lots of the red meats, from fried foods, from fast food. So that's really kind of number one. And it can be fun, it can be interesting, cook how you like to, but those are kind of the things we like to focus on because that can make such a big impact. And the other is activity. So you don't have to run a marathon, you don't have to use the stair climber, you don't have to get on your bike, just something that you like to do, get active every single day. Even if it's just 5 minutes to start or taking breaks during the day, walking up and down the stairs, doing a couple laps at work, anything to get active and get moving. And then the most important,
I like that, because I read somewhere that people feel like you have to be fit to be fit.
Right.
Like, oh, I'm not the person that runs 6 miles on the weekend, so there's no point. But there always is. You can walk around the block after lunch.
You can dance in your office.
I agree.
Anything, again, just to really get moving, get active. And then, of course, smoking. It's not a talk about lifestyle modification without talking about smoking. So smoking cessation, including vaping, very, very important to help reduce cardiac risk, because it's one of the actually, and I hate to say the word easy because I know it's not easy, but it is one of the easiest things, one of the most modifiable things that patients can do to really reduce risk.
I agree. And I would add, for many of us who work in the health policy, food advocacy space, people would say, well, Dr. Ward, it's expensive. Fruits and vegetables are very expensive. And of course, we have food deserts, even in our community.
Yes.
We've done a couple of things at RWJ. At Jersey City Medical Center, we have a food pharmacy that provides fresh, nutritious food. But I always tell people, find a local farmer's market that may not be as expensive. Meats might be expensive, but lentils are usually cheaper. Organic beans, all those things. Again, I'm not underestimating how difficult it is for some of our patients to have access to that, especially in these times. But again, whatever you can do, there are people that in communities that start their own local gardens and grow their own fresh produce. And it's all incremental, wouldn't you say? It's not all or nothing. So if you have one fruit more than yesterday, that's still better than nothing.
It really is. And I love that. It is. It is all incremental, and it's not an all or nothing.
Correct.
Like a lot of times patients will say, well, I didn't eat healthy today, or I didn't exercise today, so that's it, I'm done. No, every day is a new day. And we know that it's hard, and we know that it's a challenge. And it's really whatever you can do to make those small steps. And they don't have to be huge steps, but make those small healthy choices and make it a habit. Because once it's a habit, it'll be lifelong.
Yeah, I have a personal story. My mom, who had a healthy heart for the whole of her life, she used to walk 5 minutes a day on the treadmill. And I was a young medical student. I was like, that doesn't do anything. Many years later, I think, she was consistent. Yeah. That probably did something.
Yes.
She would watch the morning news on her treadmill for 5, 6, 7, 8. Eventually, she did 10 minutes. But even that, I would say, it's better. There's something we could pass on to the patients and to the world. Every little bit matters, and it's not easy. So talk of lifestyle changes. There's a lot of, wearables, new apps out there. So we have our Gen Z patients. It's like, which one should I have? Do they help? Should I have a wearable device? Should I wear a glucose monitor? Which one helps my heart health?
So that's a great question, and it really is patient specific. So I have patients who love them. I'm one of those people. So I have my watch, I have my ring, not wearing it today, but have it. And I love them because it helps give me data. So I'm a very data-driven person. But if you are not a data-driven person, or you're going to be someone who obsesses if your heart rate goes up by 5 beats on a day, then I would say do not use them, because it's actually not going to be beneficial.
You're going to be stressed, which is going to be bad for your heart health.
So we don't want that.
I remember that. Okay.
We only want something that's going to help you with data. So do you need a wearable? No. You do not. But if it will help you, if you like it because I can close my ring or I can count those steps and get my steps in, then absolutely use that technology. Glucose monitors, some people do like them when they're doing, some of their diets and things of that nature. Really, I would say for diabetics, it would be the best. But if you like that, again, if it helps you, no harm in using it.
Well, this has been an exceptional time. Thank you so much for all your pearls of wisdom. Really take care of yourself and your heart health. Get tested early. See your cardiologist, your primary care doctor. Dr. Alexandra Ward, thank you very much. Thank you for joining Hudson Health.